for the March meeting of the Healthcare Task Force team of NFC Forum. So we are going to have a very special member meeting today because we are starting with a presentation, as part of our mini series that we are planning, where we give our members the chance to present a small insight or a use case of their daily job or what they are working on. So before going into that or into the agenda and deeper, I would like to start with a short introduction round so everyone knows what exactly we are talking about today. So from my side, I'm Stefan Genser, Chair of the Healthcare Task Force team, working at Identiv as Sales Director for European regions, and yeah, very much focused on NFC and RFID applications for healthcare customers. Then let's go on maybe already with Nate, since I have you second on my list. You're then a new face for the member meeting, a guest speaker, maybe a short introduction. I mean, you will give a more detailed introduction anyway later on.
Yeah, so it's Nate Boutte. I'm a PharmD by training. I've spent the last 15 plus years in retail pharmacy, specialty pharmacy, as well as the pharma world. So lots of experience and lots of interest in NFC's applications in the healthcare world. I think, Tamar, you're next up.
Yes, so excited you're here with us today, Nate. Tamar Sapir, I'm the founder and CEO of Synchronix, and very excited to share our applications with you today.
Thank you, Tamar. Let's go on with Bart. Bart, can you hear us?
Yes, I can. Can you hear me?
Yes, very well.
Okay, unfortunately, I can't turn my camera on, so I'm not sure what that is. But anyway, I'll just go. I'm Bud Corporal with EM Microelectronic. I'm an actual RFID project managers, and related to this group, I support some design-ins of EMs, ICs in various healthcare projects in North America.
Thank you, Bart. Let's go on with Christoph.
I'm Christoph from Keo Labs. We provide testing tools for all the NFC technologies. I'm also the vice chair of the retail and payments. And yeah, happy to be here today.
Thank you, Christoph. Myra, some words from your side?
Yes, my name is Myra Macias. I'm with the NFC Forum. I do SIG support, which is our special interest groups, and I also do liaison support for the forum as well.
Thank you, Myra. Let's go on with Jenny.
I'm Jenny Cron with Avery Dennison. I work as a market development manager, especially focused on healthcare.
Thank you. Let's move on to Fergus.
Hi, I'm Fergus. I'm from ICPR. We are the PR agency that works with NFC Forum. So we work closely with Mike and Barb on developing some of the key messaging. So today I'm just going to be listening to what you all have to say and seeing if we can develop that into some content moving forward.
Great, thank you. Barb, your turn.
And I'm Barb Swayfer, and I work with Fergus and with Myra for the NFC Forum. I'm the marketing director for the NFC, and I listen into a lot of the SIG meetings to find content that we can use to promote our NFC brand and get the word out about what NFC technology does in the marketplace to companies and to the broader public to get them to understand what we do here.
Thank you, Barb. Then let's go on to Niraj.
Yeah, hello. I'm Neeraj. I represent Infineon here, and I'm the product marketing responsible for NFC products at Infineon, focusing on healthcare besides other applications for NFC in general. Happy to be here.
Great, happy to have you. Let's go with Mark. Hi, Mark.
Hello, Marc Lejean from NXP Standard team, working on standards.
Okay, great to have you here. And last of all, Marek.
Last but not the least, my name is Marek Truzinski. I am the lead engineer for technologies at Zebra Technologies. Zebra is manufacturing the mobile devices. All of our mobile devices have the NFC, of course. So we're one of the first one which we introduced the NFC forum mark on our devices. So we mark all of our devices with the marking, and my pleasure is to working with you guys.
Great to have you here. Perfect.
Thank you.
Okay, then let's take a quick look at the agenda for today. So we have two main parts. We will start with a mini-series presentation from Synchronix and PharmD. So our new vice chair, Tamar, was so kind to offer this presentation to us, and she's going to give us some insights on her work and also on the use case and how it is in the market. And this will take approximately 15 minutes, I would say. We have some time for open discussion. And after that, depending on how long the discussion with her will take, we will move on to the agenda of the general member meeting, which we have today. So some follow-ups of the last meeting, outlooks, topics, events, which are coming up, and the topics which are going to be discussed during the next sessions, which we are going to have. With that said, I would already hand over to Myra for the presentation of Synchronix and PharmD.
Thank you, Stefan. Let me just share my screen. And can everyone see my PowerPoint presentation? Okay, perfect. Yes. I'll go ahead and turn it over to Nate and Tamar.
Perfect, thank you. So once again, thank you so much. I'm really excited to kick off the mini-series with this team. Definitely, we are relatively new to the NFC Forum, but very excited and happy to share our perspective, our experience into this. Definitely not experts in the NFC or the technology side. We're tapping into this, and that's why we love tapping into your brains as well and kind of help us shape this field. We're not experts in healthcare either. We know the problems of healthcare. Healthcare is a very complex space. I myself have been in this healthcare space for the last 15 years as a researcher, as a healthcare executive in the medical education side. That's what I did. I investigated the gaps in healthcare and where they exist, and especially as it pertains to the gaps among the healthcare disciplines, whether those are your health systems, your pharmacies, your payers, and the patients, where mostly the patient falls in between the cracks. And in our work, we set up a lot together. We walked around the hallways of the health systems. We talked to the executives, we talked to the administration, and that's where the idea and the mission of Synchronix came about, because these silos in healthcare are really creating opportunities and gaps to ensure that patients receive the right care at the right time. So our approach is to be able to simplify this process and synchronize the stakeholders, even though it's complex and there is no one solution to address it all. But that's kind of like has been our journey, and especially one of the key areas. And Myra, if you don't mind, actually, let me introduce Nate before we jump into the triggers of how Synchronix came about. So, and actually one of the areas and opportunities that we're mostly focused on our medication adherence. And at the time that this has been 3 years ago, started the company, I was looking at who are the experts in the space, and I found Nate to be one of the key champions, not only as a pharmacist, but also as a healthcare champion and innovation in mind and spirit to understand really truly what's happening. So I would love to kind of like introduce Nate, and also this is really an opportunity for us within the space to tap into his experience and understand what's happening on that end.
Yeah, so Ms. Tamar mentioned she reached out and found me. I was still working in specialty pharmacy at that time. And for you guys who are not familiar with specialty pharmacy, essentially you think of your traditional retail pharmacy where you get like your blood pressure medications and things like that. This is for the high dollar drugs, the ones you hear about on the news that are like $20,000 a bottle, so on and so forth. And one of my big jobs was removing the barriers for patients to get these medications through patient assistance programs and things like that. But then also, because these medications cost so much money, insurance companies were absolutely invested in making sure that the patients were actually receiving the therapy and that they were getting good results with the therapy. And that's where the adherence piece really came in. And I think, Myra, if you go ahead and go to the next slide tomorrow, I'll kind of go into a little bit more detail of what that looks like and why it's so important.
Yeah, and I can kind of kick this off, and we can go a little bit back and forth on this, especially and from my perspective, as we're really talking with all these health stakeholders from a provider perspective. When their medication is being prescribed, regardless of where that is, these patients are being pretty much sent to a black hole. These patients have to deal with a new diagnosis, with a prescription in their hands, they're leaving the clinic, and from that time point, they're on their own. But not only that they're on their own, there is no visibility back to the healthcare team, right? Whether it's your healthcare providers, your pharmacists, oftentimes the insurance companies, we don't know whether the patient picked up the medication for the pharmacy. Did they initiate to take their medications? What challenges are they facing? Whether they have complications with accessing the therapy, with insurance coverage, transportation to pick up the medication from the pharmacy, or actual side effects, complications, and other areas along as they're going through their journey, which leads, and actually data demonstrates that over 50% of patients stop taking their medication 6 months after the diagnosis for patients with chronic conditions and are non-adherent, meaning they're not taking the medication as prescribed, either not properly or discontinuing their treatments, which leads to hospitalizations, complications, treatment failures, and actually one of the largest triggers for mortality in not only in the US, but worldwide, and leading to a major impact on the healthcare system, right? So there are solutions, and Myra, if you don't mind to go to the next slide. In terms of the impact and like, what does it mean to the different healthcare stakeholders? And I kind of want to jump back to Nate, because regardless of where you are, whether in the healthcare ecosystem, we all want to make sure that patients access the medication and take the medication on time. And it not only impacts the clinical outcomes for that patient and the experience and the safety, of course, which is important, but creates opportunities and needs for every stakeholder to ensure that they have not only the visibility on what's happening with that patient perspective, but ensure that they can reach out to that patient at the right time for that proactive, addressing proactive gaps in care, right? So
yeah, I'll jump in there and kind of to Tamar's point on the previous slide, all of those issues, they've been identified previously, and that's kind of what birthed specialty pharmacy in general, because the specialty pharmacy did have more touch points with the patient. So instead of like the once every 3 months or once a month, they were calling the patients more frequently. And instead of having the patient necessarily come to the pharmacy, we would mail medications out, right? So trying to fill in those gaps that the healthcare system had. So it was kind of born out of this concept of the leaky bucket. And the leaky bucket was basically for every 100 prescriptions that were written, only 50 of them actually made it to the pharmacy, the piece of paper. And then of that 50, only about 25 of those actually somebody came in and picked it up. And then only about 50% of those, so another 12 or 13 of those, somebody actually came back and got a refill 30 days later. So with specialty pharmacy, it's like, well, we're going to send the prescription directly to the pharmacy. We're going to fax it to the pharmacy. So we'll eliminate one of those steps. And then the medication is going to be mailed out to the patient. So we eliminate one of those steps. And then the specialty pharmacy actually calls about 5 days before the patient should be out of the medication to make sure that they get a refill. So that's about a 25-day gap from the last time we know that the patient, at least the medication made it to them. So we don't know if they're actually taking it. We don't know if they take it for a few days and stop. So there's still a lot of gap there, but it still closes a large portion of what we saw on sort of that first slide. So if you kind of look to the slide that we have up there now in the upper right-hand corner, the pharmacies, right? So increasing refills and time to fill and improving therapy management. One thing about medications, we all know, they only work if you take them, right? And so with that, the ability to give the medications and make sure the patient is taking the medications, then you have that increase for the pharmacy, right? So like pharmacies, they only get paid for work that they do. And so if they're not doing refills of medications, if they're not filling the medications on time, they're not getting paid, which goes into the bottom right-hand corner there, the providers, right? So the providers, they want their patients on the medication so they're not having to come back, they're not having to get hospitalized. There's nothing worse than a doctor to write a prescription for someone with high blood pressure. If they don't take the medication, they end up in the hospital, you know, with a heart attack or a stroke or something like that. That's doing them no good. And then if we kind of look over to the bottom left-hand corner, the payers. So I worked for a large national chain pharmacy, and we worked with the Medicare Medicaid system. And the Medicare system will actually give star ratings depending on how frequently patients' prescriptions are filled. So it behooves the pharmacies to make sure that the patients are getting their medications, because that star rating depends on how much reimbursement the pharmacy will actually get. So pharmacies are actually getting paid according to how well they're doing their job from what they tell the system, which brings us to the upper left-hand corner in pharma, where currently pharma has to depend upon patient-reported outcomes when it comes to whether or not they're taking their medication, which brings us full circle to the middle there with patients, which that is the most important part of it. And what we do is now patients can see what they're taking, when they're taking it, how often they're supposed to take it. That's really kind of the center of where we feel like NFC can really, really play a role in increasing and enhancing patient lives. I'll throw it back to you, Tamar.
Yeah, and just another point, Nate. Can you share with us how is adherence currently in clinical practice being monitored or documented? Is there?
Yeah, I think the next slide actually, does that have a couple of pictures there? Yeah. So if you look kind of in the middle there, the MedPack Smart Card, you guys have seen this before. This is like when you go into the thing, they got the little Monday, Tuesday, Wednesday, and you kind of put the pills in there. So that's not just for in the pharmacy if you got to do this for your mom or dad. This is what we did in specialty pharmacy to try to better maintain medication therapy for patients who were taking literally oncology medications that were $25,000 a bottle, with sometimes as few as 12 pills in them. We were literally putting them in those blister packs. That's what's going on today. This was one of the best ways to ensure patients were taking their medication. We would literally call and say, you know, hey, which day are you on? How many have you taken? So on and so forth. And that's the best way that we had to really maintain and know what the patients were doing with the medication. And again, this is just a lot of manpower, a lot of time, a lot of money being spent to make sure that patients were taking these medications. And of course, if you look at some of the other things that are on this slide here, you think about apps, you know, everybody's got a smartphone. So, you know, reminders, alarms, there's some smart caps that are out there. There's some ingestible pills, dispensers. You know, if you think about directly observed therapy used to mean a patient had to come into a clinic and the doctor would have to watch them take the pill, or someone would have to, like a nurse, go out to a person's house and watch them take a pill. Now with today's technology, you can obviously do like a FaceTime or something like that, but you still, like, it's involving a lot of time and money to have somebody, because if you got, you know, 100 patients, somebody's going to be on the phone all day watching people find their pill, take it out, take the medication, so on and so forth. So there's a lot of things that are out there now. They all have their pros and cons, but I think that there's definitely room for improvement. So when we talk about gaps, there's a lot of stuff that's out there, but this is a gap where none of these are really just kind of filling in all of the gaps that are there. Tamar?
Yeah, definitely. And one of the areas that currently today is also being the only way outside of the technologies that have been out there for in the healthcare system to document adherence is actually a measure that's called proportions of days covered, PDC. And that's a measure to identify whether a medication was available for that patient at the pharmacy. And that's the measure that is really being documented and being incentivized by these the quality measures, etc. But we know, and Nate knows really best, that this is not an objective measure. It's a very subjective, because it kind of looks back 3 months backwards, and it doesn't necessarily mean that the patient took the medication. So there is definitely a need to replace these measures, improve these measures, and to ensure that you can identify in a proactive way who are the patients who have their meds on hand and cannot, and are actually not taking it, and understand the reasons for it, right? Understand what might be the reason that this patient is having issues, so maybe we can come in and address that. So the technologies that have been, there are a lot of solutions out there, and they are effective, and actually have demonstrated in trials and evidence that they improve adherence in different measures. And as you are probably familiar with several of them, they include the RFID technologies, softwares on one end, devices on other end, that may be limited in terms of the type of medications, the dispensing, the packaging, being intrusive to patients, whether patients like it or not, or how integrated are they actually within the clinical workflows, and can really understand the holistic approach from patients. So our approach coming into these technologies are great and wonderful. How can we ensure that we can improve health among all patients who have chronic conditions in a simplified, so that they can be linked to the care that they need at the right time in a most simplified way. So the next slide, that's kind of jumping into, and again, we're not the technologists. We just went back and looked for what technologies are out there, right? Like, we wanted the technology that is seamless, as seamless as possible, that can be done, that can be easy for the patients, and can be applied to any medication container, doesn't require too much of extra work from the healthcare team side, and provide that real-time data for the healthcare team to bring that visibility. So Tapped Health has been the product we have developed over the last few years. Next slide, Myra. And those are basically your true and beloved NFC labels that are being applied to medication containers. And the way we're applying them is that we're encoding them for every patient and the medication schedule. So now when that patient receives the medication from their pharmacy, from a healthcare team, with that label affixed to it, all they need to do is tap their smartphone against the label every time they take their dose. So we created a patient interface in a very simplified manner, where they can see all the taps that they have due with, relating to their medications. Each label is assigned to each medication and their treatment schedule, where patients can be engaged throughout their journey. And because it is personalized, it is also personalized to their experience. It is personalized. Myra, can go to the next slide. It is personalized to their condition, medication, so the entire journey can be provided to them and link them to the right resources, the right education, their own data, so that they can be empowered in their own journey when they're being prescribed with these medications, so that they don't need to self-report. It makes it easy for them to record, but also to connect back with their healthcare team. So now their healthcare team has that real-time visibility on a clinician dashboard that can be either a standalone dashboard or integrated within their workflows to identify those patients who are most at risk deviating from their adherence thresholds, or also have been reporting specific concerns or worsening outcomes. Because now that we can know if a patient took their meds or not, we can also push out patient-reported outcomes. How are you feeling? Like, do you have any reasons why you initiated or didn't initiate? What challenges you have? So we are really understanding the gaps that are surrounding that patient, and can create risk stratification based on these factors for these patients, and then enable that linkage to care. So then we can link them to those services, whether it's education, transportation, food programs, whatever programs are available already within the system or external, so that that becomes a true linkage to care approach. And then from a data analysis perspective, of course, we're looking at very sophisticated data models and predictive models to understand the different populations and ensure that programs can be devised and approached for these patients. So just to wrap up with a case study, we have launched these programs across health systems, academic institutions, clinical trials within initiatives. So those are for patients with chronic conditions, with targeted therapies. Think about your oncology patients, patients with inflammatory bowel disease, HIV, hepatitis C. So we created the whole journey and program for this, for the diverse patient population, and have conducted studies and trials across. So Myra, next slide, please. So this is just an example of a patient who actually started. We can actually see whether a patient took their meds. That patient actually was on the program for just a week, and then all of a sudden you can see that on day 8, that patient stopped taking the medication, and the system triggered the question like, why didn't you take your dose? That patient responded, I did not take my medication because I don't think it's working. So that triggered an alert to the clinical team, and then within a matter of 2 days, that patient was invited back to the clinic and was confirmed that their disease was progressing, required immediate medication change, which really avoided complications, side effects, and a surgery.
And let me jump in there real quick, Tamara, just on this example here. So we work in the HIV world as well. And so day 12, patients on a new medication. Currently, the best we would be able to do is probably about twice as long. So maybe 25, 26 days before we would even know the patient didn't take the medication. And then even if we were able to get them a new medication that same day, we're still talking about an extra 2 weeks. And in the world of HIV with medications can develop a resistance. So the medication that works today, if you don't have enough of it in your system over a set amount of time, it may no longer work after 2 weeks. This is the reason why when your doctor gives you an antibiotic, they say you to take the entire bottle, because the virus can develop a resistance. So it's literally that time, that 2 week time frame could be enough to save somebody's life, because we know that they're not taking their medication or the reason why they stopped taking their medication. So go ahead, go to the next slide now.
That's an excellent point, Nate. Absolutely. And here's another example of a patient like that we can see how that real world data, right, that real-time adherence data, when you start to understand really what's happening underneath the hood with these patients, how we can close these gaps. So this is a patient who started taking their medications, and Myra, the next slide, please. We can kind of go through. That patient all of a sudden started to use their medications less frequently and less. So you can see that actually that triggered an alert. Sorry, go back. An alert to the provider, who reached out to the patient and actually realized that the patient actually admitted that they started rationing their meds. They started using, because they didn't want their meds to be completed because they lost their job and had no insurance. So that actually triggered for the nurse and the pharmacist to collaborate and to ensure, to go back to ensure that that patient has access to a patient assistance program, so can give that patient free drug until they're able to retain their insurance coverage. And that's another opportunity where this would have not been addressed if that type of information would not be available to these patients. And that was in a matter of a couple of days until the next slide. Myra, you can kind of see how that patient immediately went back and stayed in the program. So that's just another example. And that's it, that we definitely want to open this up for conversation in terms of this is kind of hear your thoughts and feedback on whether these applications have been of use to you. Have you used anything similar, but also any ideas on where your kind of mind is going in terms of where NFC can continue to support this type of application. So we'd love to go around the room and hear any questions and feedback.
Hi, Tamar. This is Marek. I have a couple questions for you. You require the user to install the application. So I think that not all the patients are really, technically savvy, especially, older. How is complicated to install the application, and when you kind of enforce, because without the application you cannot do any monitoring and also provisioning, yeah? When you require and how this process actually works, I would like to understand.
Yeah, so we have not necessarily developed a native app, but it's a web application. And patients are being invited by the healthcare team to participate. So when that invitation is being initiated, these patients are receiving a text message, a link, they create a username, password, and their account is set. So there is not a lot of technically savvy steps. However, they may need some support, and that's actually what the healthcare team, the designated healthcare team, are supporting them with enrolling and onboarding them into the process.
And if somebody doesn't want to use the NFC, there's any backup for that?
Yeah, so the web application is fully standalone. They can self-report it on the app itself as well. So it doesn't, the NFC makes it just another easy step to engage.
And perhaps you can use the QR code as well, yeah?
Exactly.
Yep. Thank you.
Mm-hmm.
Okay, one more question from my side, maybe. I mean, the use of NFC, of course, is in this case, yeah, I would say not necessary, since you can also use QR code, but it's quite convenient, and that's also why we are doing all these labels for packagings of pharmaceuticals. My question would be, who is doing the whole encoding? Is this the pharmacist himself who would need to add all this personalized data to the NFC tag in order to share the right information for the web application?
Yeah, so someone will need to do that, right? So someone on the clinical side, whether it's the pharmacy, the nurse, the case manager, whoever is ensuring that those patients are being enrolled. However, this information can also be imported, right, from your claims data, your medication records, your health, your EMR data. So if done correctly, and kind of like you can kind of simplify that process with automation and integrations.
Yeah, just to kind of to that point, most pharmacies already use some type of system. So like if you think of, say, Epic in hospitals, or like a pharmacy that I worked with uses Symbia, we've already got patient profiles with patient medications and prescription numbers and everything like that. So that information is pretty much just sitting right there. And it would just be a simple matter of attaching that information to the one NFC label for that patient. So it's not starting from scratch, like, okay, here's patient A, and let's build out everything that they need. That information is kind of already sitting there, and it's just a matter of having the systems talk to each other.
Mm-hmm. And is the most important party to drive the NFC or this whole technology, is it the insurance company, or is it more or less the medical side, so the clinical side, who would drive this? I think it's the insurance side, right? They would have the most ROI out of it.
Yes and no. So that's kind of the beauty of it, is that yes, the insurance side, they can see whether or not the patient's, actually taking the medication, and, they can, do things that they want to do with it. That data is there. But when you're coming at it from the sort of the healthcare lens, as a provider, we're thinking patients have got to take this medication. And so many times, if a medication, for example, was not working, we just assume a patient was not taking the medication. The ability to like literally see if this patient is taking their medication, or know when they stop taking their medication. When Tamar told me about this, I'm like, you got to be kidding. Like, it's just amazing to be able to know. And even if the patient, for whatever reason, decide like they weren't going to tap, we would know that too. Just like, oh no, we know to call, we know to reach out to that patient. So it makes our lives on the healthcare side so much easier to know that, hey, Miss Jones is taking her medication. I see where she's tapping every day, but Mr. Smith, he hasn't tapped, he's tapping every other day, or it just would allow us to move so much faster to get these patients taking their medications. Because like I said, when I talk about the specialty medications, these are your high dollar oncology, HIV, Hep C medications where, if the patients don't take them, they don't get the results that they need. And so to your point, yes, for the insurance side, because, a complete course of a Hep C medication is, I also used to say, it's like a small BMW, because you're talking about, $40,000, $50,000 worth of medication. But once they're done taking it, when taken properly, they're cured. So the insurance company does not have to worry about them going back to the hospital for a hepatitis flare-up. So it's beneficial to a lot of different people in different ways. As far as strictly dollars go, probably insurance companies, to your point, because they'll know, and they're not having to spend that money when the patient goes into the hospital. But as far as health outcomes and things like that, it's really, really important as far as the patient goes. Which, of course, I'm looking through the lens of a pharmacist and a healthcare provider, which is why I'm so interested to hear what you guys think about this. Because I was talking to my wife, and Apple's got this thing with the Department of Justice or whatever, and I'm like, who has a bigger user base than Apple and Android combined? NFC. Everybody has NFC, and so I'm really curious as to what you guys think about this.
Yeah, and what I will also add, and I'm very curious too, is the other aspect that we haven't touched upon. At least in the US, there are more and more opportunities for ensuring that these providers are actually being reimbursed for starting to utilize technologies like these. The entire world of remote patient monitoring has been taking a lot of interest and uptake in terms of ensuring that these patients, when they're discharged from the hospital, they have their glucometers and their scale and the blood pressure cuffs, right? And these patients are actually being monitored remotely by the healthcare team, including pharmacists, including providers. So there are dedicated teams that are monitoring patients, and even hospitals at home divisions, with opportunities to generate significant revenue out of these programs. So remote therapeutic monitoring is actually the entire aspects of all the monitoring of data that is non-physiologic, including with a very high focus on adherence. So, and that's another relatively new program that started in the US for Medicare populations in 2022 that enables these providers to generate revenue from ensuring that these patients are being monitored from home. So that's an evolving field, and definitely an exciting space to be in terms of how do we ensure that the entire healthcare team is being committed to ensure that these patients receive timely care in their homes, right?
So this is Bud Corville. Following up kind of on a question that Stefan started with, kind of the data encoded onto the NFC tag. Is the medication then, is it linked to someone's specific phone when it's, so that only a specific phone can tap on a medication? Because I'm thinking about, if any phone can tap the bottle, then any phone can mimic the patient. Is there like a one-to-one, medicine to specific phone or phone app step that happens?
So maybe that's a question that's beyond my technical knowledge. But our CTO will be able to provide a more detailed approach, but it is to the patient account. So that label, once that label has been linked to that patient account, that account will be able to track that tap.
So, okay, so any phone that has the app and that the app has the right credentials,
Correct.
then all the access to the cloud data happens automatically. Okay, all right. Yeah, that makes sense. Yeah, I mean, obviously, one of the other key aspects of NFC is just the whole authentication process, right? To understand that the medicine you tapped is indeed the medicine you need to be taking. So there's multiple other capabilities that are enabled when you tap that bottle, in addition to this use case, which is very interesting. I can certainly understand how it takes the management of medications more real time, and which, yes, would allow for quicker feedback to the patient. I see that. But in addition to that, there's a lot of other security and safety that tapping on that medication that would be available, whether it's authentication, dose verification, expiration, right? There's all things that come with it, with NFC enabled tags like that. So anyway,
I think the whole security part of NFC, this is something which might be more interesting to the manufacturers who want to improve patient safety just by this authentication checks, for example, where you need this unique safety features of NFC technology. However, once we are at the point that the majority of medications in the market are already shipped out with an NFC tag, I think there must be some standard to say that there's a certain ID or memory on these tags also needs to be free to use for the pharmacists, for the clinics, so that also another party can access more or less the NFC tag and make use of it. So I don't know if there are any discussions in the US going on that. I just know from Europe. In Europe, everyone is so keen on standardizing everything.
Yeah. I do think that this area, I know that if I think about the UHF side, which of course is not NFC, there's a lot of discussion around how to standardize the data that go on the UHF RFID tags, and so I think this forum could easily leverage a lot of that discussion. It'd be great to have the same constructs and same data, because to your point, yeah, if with more and more medications coming from more and more different possible sources, the only way to understand, the only way for a patient to truly, I guess, get the ultimate end value would be is if the data is the data on the tags is all formatted in a way that anyone can use it correctly. Yeah. So standardization seems like a big activity here. Yeah.
Mm.
Yeah, those are excellent points. Definitely, as these type of technologies are being validated across the supply chain, right? And ideally, these labels, once they are being added by the manufacturer, you can kind of like see the applications across the entire, that entire journey for the patient and the healthcare systems, right?
Mm. But it might also be quite interesting to combine it. I mean, Identif is doing, for example, projects with CVS Pharmacy in the US. So they do have a system to add a tag to each of the pill bottles in order to tell to visually handicapped people what is inside, to whom it belongs to, things like that. So you could also make use, of course, of this tag for your application.
Yep, absolutely. And I'm actually excited to see the evolving space of NFC as soon as you can have multiple actions, right, with one tag, right? It can perhaps speak out which medication that is and record your dose at the same time.
Right, yeah.
So we'd be happy to receive any feedback, any questions and opportunities for collaborations, and kind of like this is more an open forum for let's brainstorm, let's kind of like think far and at the same time where this can go. So hopefully this triggered a little bit more just a thought-provoking process and an open conversation.
Tamar, one last question maybe from my side. What additional barriers do you see if you think globally about your application? I mean, I think you are focusing strongly on the US market, which is obviously the biggest one, I guess. But what is beyond the US border? What do you see there? Are there additional possibilities or use cases?
Yeah, that's the beauty, that it's like it's beyond any borders, right? But I think what we're mostly focused on now to make sure that the integrations are seamless enough, right? That the data is not duplicative, and what does the data really mean, truly mean, and how do you translate that in the most actionable and meaningful way to the healthcare team, and especially the complexities when you bring these stakeholders together. You have the pharmacy, your provider, your payer, your pharma companies, and that has been, you know, probably our key focus to ensure that because everyone wants to have their hands on that type of data, but how do you ensure that that seamless integration happens in the back end? And then time will tell. Like there might be patients that, you know, this might be a good fit for them. There might be different populations. And of course, we're also thinking about who has access to internet today, right? Like there are rural areas and silos for internet access. How can we try to widen the gap and shorten the gap and ensure that this can be applicable to anyone? So that's kind of what keeps us now kind of thinking about this, the next phase. But yeah, I would be happy to hear like if you think there are other opportunities outside that, or, you know, standardization or regulations we should be thinking about as we keep expanding it further.
I'll just chime in with one last thing because I know you guys got to go. We thank y'all for letting us monopolize so much of your meeting time today. But this is really just like a top line, broad overview of the system. And I know there may be some more questions acting on another meeting and talk more about specifics around the way the system works. And, you know, like we could, you know, bring, you know, Roy on here and he can give more detailed answers about the technology side of it and, you know, how the linking to the patients happen and things of that nature. So if you guys are interested, we would love to, you know, talk more about it, because like this was like the brush fast, quick version of, you know, what it is the system is and what it can do. But thanks again so much for you guys' time today. Really, really appreciate y'all letting us come on and talk.
I need to say thank you for your presentation. Yeah, also from the task force side, this is very valuable for us. And I mean, the recording will be shared afterwards, so other people, other members will have the possibility to watch it again. And yeah, I mean, if you share, I mean, we anyway have the contact details of Tamar. So if someone wants to reach out, they will reach out to her anyway. But looking
Awesome.
at the time, I think we should anyway come to an end. It took longer than expected, but very interesting though. Thank you very much. Myra, I would then move to my slides again, if you could give me the presentation rights. Just making use of the last 8 minutes, moving through our general agenda of the member meeting today. Oh, that was wrong. Okay, so just some administrative topics, as every time in our member meetings. We the February member meeting meeting minutes have been shared. So please let me know if you approve to these meeting minutes or if you have anything to add. If not, I think we can consider them as approved for Myra. And as always, I also want to add that there's still the open position in the healthcare task force team, which is the secretary position. So if anyone is interested in supporting us here and taking over this position, just let us know. Next are some follow-ups from the last meetings which we had. We are still in discussion of the ebook summary to summarize the topics which we discussed in 2023. So here I'm still having the to-do to reach out to Barb to discuss the possibilities which we have here. An update which we also received last time from Myra is that there is a member collaboration folder now available online in our healthcare task force team. Here's a small screenshot from it. So if any one of you finds any article, documentation, anything which you would like to share with the team so we can discuss in the next member meeting, feel free to add it to this collaboration folder. So we will screen it and then we will also include it into the next member meeting slides. And also I want to highlight again from last meeting that there is a private YouTube link for the past mini series. So we will also collect these from the last year. And by clicking on this link, you will be able to access this video, this recording. Please be aware that you cannot search for this video in the searching bar. So you need the link, otherwise you will not find the video. Okay, then let's have a short outlook to 2024. So we are now in March. We just had the March member meeting. Next up is going to be the member meeting on April 25th. And after that, already there is the first face-to-face member meeting, which is going to take place in Taiwan this year. Looking at my own schedule, I will very likely join this meeting this year. Myra, will be good to see you for the first time there, face-to-face, I guess.
Yes, that's
Maybe also
exciting.
some others of you. So yeah, mark it in your calendar if it's possible for you to join. It will be Monday, May 13th, when the Healthcare Task Force team will also present during the IoT SIG meeting there. Right, something which is also going or proceeding in our planning is the next member presentation, which is going to be very likely EM microelectronics. So we are in preparation of a small mini series presentation on NFC and UHF combined applications, so dual frequency applications. So here we are currently working on it. This will either take place on April 25th, so the next member meeting date, or in May. I assume it will be more the May meeting, but this is something which we will clarify within the next couple of days. Right. Then something I would also like to mention is, of course, the next RFID Shown Live exhibition or conference in Las Vegas, taking place on April 9th to 11th. So this is definitely the biggest show around RFID in the world. I mean, all the manufacturers, all the system integrators, so the bigger ones, they will be there, they will exhibit there. Also from Identiv side, we will exhibit a lot of our use cases from healthcare side. So if you have a chance to visit, do so. It's really a unique show on RFID side. And there is also always a big focus on NFC, obviously. So you will see, or we can probably tell about what is new in the market next time when we meet from those who visit the show. I don't know, is anyone here who is going to visit the show from the members?
Stefan, just so you're aware, Mike is also speaking on behalf of NFC Forum at RFID Live.
I already saw that, yeah.
Okay.
Perfect. So yeah, keep your heads up. Then we still have a lot of topics which we would like to raise throughout the year. This is just this summary slide, which I'm always carrying from member meeting to member meeting. we will have next member meeting time again to think about what else we would like to discuss, which questions we would like to raise to the room in order to discuss with the members participating in the member meetings. So for today, I don't want to focus too much on it. Let's focus on it next time when we have time here. So before the hour ends, this is my reminder for the next Healthcare Task Force member meeting, which is going to happen on April 25th, same time as usual. So I'm really looking forward to seeing you and welcoming you again on that day. And that's all so far from my side. If there are any open questions, please let me know. The floor is yours.
I have one thing that I wanted to plug. We do have a
Please go ahead.
webinar. We have a ABI research on contactless market and user trends webinar that is going to take place on Tuesday, April 16th. We did send out a email communication to the entire forum, I believe on Tuesday, letting everyone know that registration is now open. So this is going to be a 45-minute webinar highlighting the key results of ABI research. So we hope to see everyone there.
If I can just correct you, Myra, there's
Oh yeah,
actually
go ahead.
two.
Oh, there's two.
There's a member only that is an expanded, that's you get the full ABI research study on April 4th. And that's only available to members of the NFC forum. The public study overview is on April 16th. You can go to either one, but members only is on the 4th, and there'll be a discussion after the presentation of the data, and there'll be a little bit more data presented there. And then once that member only session is presented, the full data will be available on the member workspace. So keep in mind that that will be up at that point.
Thank you, Barb.
Okay, thank you. I assume that the invitations will be sent out as usual, right?
Yes, the first round has already gone out. And Barb, when will people be expecting a second communication?
Actually, I just pulled up the calendar. You should be getting, what is today? Today's the 28th. You should probably be getting the public ABI in the next day or so, if not, but you should have gotten a member one in the actually yesterday. The next one will happen on Monday, April 1st, will be the member one. And then the public, everyone will get one. All members will get a public webinar one on Friday, April 5th, the day after the member one. We didn't want to send members the public webinar alert because it would get confusing. So check your email for the member only, and you should be receiving the public on April 5th, just in case you weren't able to get to the member only.
Perfect. Okay, then thank you everyone for joining today. I'm looking forward to see you again on April 25th. And if there's anything you would like to ask, reach out to me or Tamar. We are happy to help. Thank you, everyone.
Thank you. Take care.
Thank you. Bye. Thank you.
Bye-bye.
Bye-bye.